Welcome back, welcome back, welcome back. Once again, it's your neighborhood health man, Abdul Ismail. I am here for another session of the Grown Folks Talk podcast. And I think we got a good one for you today. This one is for the brothers. But, you know, you ladies, you can look out for your men with this, but this is for the brothers. So we have done a couple of shows here. We have done a few shows on, endometriosis, fibroids. We did some stuff for the men for impotency. But this one right here we're going to talk about, I think it affects most older men. And they say men over 45, you should get this checked. We're going to be talking about your prostate. And why the prostate? Because a lot of men deal with a lot of prostate issues. And it's something that's definitely easily avoidable with what would I like to say? Treatment, but not really treatment, more prevention by certain foods and things like that. So we're going to talk a little bit about the prostate. So going through my info for the day as always. I always go to the internet and get a lot of information, and then we talk straight up. So what is the prostate? The prostate is a part of the male reproductive system, which includes the penis, the prostate, seminal vessels, and testicles. The prostate is located just below the bladder in front of the rectum. It's about the size of a walnut and surrounds the urethra and the tubes that empty the urine from the bladder. So your urethra is the tube that empties urine from the bladder. It produces a fluid that makes up part of the semen. So that is your prostate. It's very small. It's actually the size of a walnut. And like I said, it creates a liquid that's a part of semen. If a man, when he ejaculates or just in general, he has a clear liquid that's a part of that, that clear liquid comes from the prostate. The testicles only create a small amount of actual sperm in the actual semen itself. Most of the fluid that's found in semen itself comes from the prostate. So that's one of the benefits. That's a huge benefit to the prostate, okay? So that's what the prostate is. It's this small organ or small organ that's a part of the reproductive system in men. So now you have an idea where it is. You have it's right underneath your bladder, and it's right where the anus kind of starts. So it's kind of like smushed in between the bladder and the anus if you want to think about it, okay? So that's where it is. Now, let's talk about what really happens to men when you hear about prostate enlargement, okay? So that is a big thing. As a man gets older, you start hearing about a man has prostate enlargement, and it's called benign prostate enlargement. The causes of prostate enlargement is unknown, okay? But it's believed to be linked to a hormonal change as men get older. The balance of hormones in your body changes as you get older. This causes the prostate to grow. All right? So they actually don't know why it happens. They believe that it is a hormone. They believe one of the hormones is DHT that can actually cause the prostate to grow. But they don't really know all the factors that cause the prostate to grow. Okay? Give me one more second. I'm going to give you some of the symptoms of prostate enlargement. Where we at? These are the symptoms of prostate enlargement. Some men have noticed this. Finding it difficult to start peeing. So a man who's urinating and is finding difficulty. Straining while you urinate. Having a weak flow of urine. Start urinating. Need to urinate urgently and or frequently. Needing to get up frequently in the middle of the night to urinate. Accidentally leaking urine or urine incontinence, okay? So you can understand, as a man's prostate is becoming enlarged, just think about it. If it's right underneath the bladder, the urethra flows through it. So think of you having like a cup and a straw. Okay, the prostate is the cup, and you have a straw going inside the cup. Well, as that cup starts to close up, as the prostate starts to enlarge, it squeezes on the actual straw. That's your urethra. Your urethra connects your bladder to your penis. So when you're urinating, it goes right through, and you urinate, right? That's like the tube. The same way a woman has a urethra, a man has a urethra. So it passes through. It allows you to urinate from your bladder to for you to urinate. Well, as that prostate starts to enlarge, it squeezes on the urethra, finding it more difficult to urinate. It just makes sense, right? Now you're starting to understand how when a man's prostate is becoming enlarged, these symptoms come about. Straining to urinate. Well, it's squeezing up against that straw, making it harder and less liquid to be able to come out. Okay? Having a weak flow. Remember, we're squeezing up on that straw. Less and less urine is going to come out at a time. It also may make it hard for you to urinate. You may push the urine out, but it stops. Then you got to push it out again, then it stops. Then you got to push it out again, then it stops. Or having a process of making you want to urinate often, the frequency. You hear men say, man, I get up a lot during the nighttime to go urinate, and not a lot is coming out. Well, remember, think about it. It's right underneath your bladder. So if it's getting larger, it's pushing up against your bladder, and it's making your bladder smaller. So it's pushing the bladder, making the bladder smaller, making you feel like you have to urinate more frequently. Okay, so you may be able to hold two-thirds of what you used to be able to hold. Excuse me. So instead of being able to hold, let's say if your body can hold 16 ounces, now your body can only hold maybe 12 to 10 ounces because it's pushing up against the bladder, making the bladder feel like it's smaller, if you want to say, can't hold as much urine. Okay, so those are some of the symptoms that come along with having an enlarged prostate. It happens to so many men. I'm gonna give you a quick story. I know someone personally very close to me who had an enlarged prostate. An enlarged prostate so bad that he had to get a catheter in it. He could not urinate. When he couldn't urinate, he could not urinate. It got so enlarged that he had to go to the hospital, and they had to put a catheter up his urethra to his bladder to allow it to open up to urinate, for the urine to come out, because it was so large. When you seen him, before he went to the hospital, his stomach was poking out because he had that much urine in his system. His stomach was enlarged, like he had a hard stomach. So prostate enlargement can cause men severe problems, and it can also lead to prostate cancer. Okay. Now, how do you diagnose prostate enlargement? There's a couple of tests that men can do, or you go to the doctor and you can find out. The first one is the digital rectal exam. You've seen this in a lot of movies. When a brother got to bend over, right? They bend them over, bend over like the letter L, bend over the table, and they make it look like real bad, and they stick the fingers up in you, and they touch your prostate, and they pull it out. Honestly, it seems worse than what it is. Now, I'm going to tell you the truth. I have not got that done. Okay? I have not got my prostate checked. I have intentions of getting my prostate checked. I say when I turn 45, I was going to get my prostate checked. Right now, I'm 44. I am not looking forward. I'm not going to lie to you. I'm not looking forward to get my prostate checked because I don't know any man, to my knowledge, just depending on sexuality, no man usually wants someone to use digits up their rectum. Just to be honest, I don't know any guy who's looking forward to, oh yeah, we're gonna get our prostate checked. So I don't know too many men that does that. But it's one of the most effective ways to actually find out you have an enlarged prostate, because they can actually feel if it's swollen. Remember, if it's the size of a walnut, normally, okay, now you go up in there and it feels like, you have like a size of an orange, you got a problem. You know what I'm saying? Or even if it's the size of a lemon or half a lemon, you got a problem, because a walnut is not the same size. And that's something they can test and they can check very easily. So the digit rectal exam is one of the most effective ways to find out if you have an enlarged prostate. They can also do a urine test. And a urine test can find out if you have an infection, anything like that, or any issues that's coming from the prostate. They can also do a blood test. And the blood test is called the PSA test. So that stands for prostate-specific antigens. So when your prostate is enlarged, it creates these antigens that come from it, okay? And they can test if you have a high amount of PSA, it's a greater chance that you have a large prostate. That can also mean you also have prostate cancer. So even if they did a PSA test, they still want to do a digital rectal exam test, okay? Even though you can get a PSA test and you can find out that, whoa, maybe I have an enlarged prostate, this is showing that I have an enlarged prostate, they also want to do the rectal exam because they can actually feel if it's enlarged versus if you actually have prostate cancer, okay? So that's another thing. So the PSA test is another way of testing out if you have an enlarged prostate. And a lot of guys come in to the store, they've had PSA tests. A lot of guys, it's usually one of the two. It's usually a PSA test or it's the rectal exam test. Most of the time, most men get rectal exam tests, but there are a few that actually come in and get the PSA test too. Okay, so those are ways that you can find out if you have an enlarged prostate.